Hi guys, this is chapter 25. This is drug therapy for seizures. That starts on 401. We're going to go through information on that. So the cause of most seizures are basically unknown. On page 403, if you go through 403, there's a lot of risk factors that come with seizures as well as the common causes of seizures. Common seizure causing drugs, and we've talked about some, and we're going to be talking about those coming up. Especially when we deal with the psych chapters, we're going to be dealing with a lot of seizures and information, as well as like street drugs and things like that we've already talked about. And also there's the risk factors for worsening of seizures with a well-controlled seizure disorder. So review those because those are very important. Otherwise, look at the information, the pathophysiology and all that in regards to seizures and things that, deal with those. Of course, we know stressful situations can cause seizures. Any type of change in a person can cause a seizure. So there's a lot of different things that cause seizures. It's just determining what is going on. We have two major types of seizures. We have generalized seizures, and you can see that on page 404. If you flip over that, types of generalized seizures. And then, of course, and that's the ones with the generalized seizures, our most important thing we have to remember, and I mean, this is very important, you must protect the airway. Anytime you get those generalized seizures like grand malls, we want to make sure that we protect the patient's airway. That is our major goal when we're talking about seizures, protecting the patient's airway, because they can have a lot of mucus coming out. They can actually bite off their tongues, and then that will obstruct their airway. Sometimes their tongues go back. So there's many things that can cause it, but our goal is to protect the airway. And then, of course, the second type would be partial. That's on page 405 on the table. And the most important thing we have to remember also is make sure we record the time and duration of the seizure. That's the important thing to know how long it is, and also what type of seizure was it. Did they roll their eyes back? Did they get all stiff? Did they clench their teeth? So we need to know what they're doing. Did one arm shake, not the other? So you need to, besides to record the time and duration of the seizure, you need to also make sure you say what happened during the seizure. But like I said, our most important thing we have to remember is protect the airway. Another thing is we want to make sure we keep the patient safe during a seizure. And especially if we know a patient has a seizure, maybe they're going through withdrawal from certain drugs or medications, then what we want to do is make sure that we protect the patient from any type of harm. A lot of times we will pad the side rails, make sure everything is moved away from them, because if they do have a seizure, we want the things that are less harmful. We don't want them hurting themselves. So safety is a big thing, protecting them from getting harmed. Another thing is we always want to make sure we turn the patient on the side after the seizure to prevent aspiration. You'd be amazed how many times when you're seeing a patient and they're having a seizure, their mouth will fill full of mucus and a lot of saliva. So a lot of times after the seizure, we turn them over on their side. We make sure we put oxygen on them to help with oxygenation, because a lot of times when they're tensing, we know that the body's not getting the appropriate oxygen. And then, of course, afterwards is called post-ictal, and everybody differs on how they act after having a seizure. I've seen people get aggressive and fight. I've seen people sleep and not do anything. I've seen people wake up and not an issue. So post-ictal states depends on what's going on with the patient. So we have two major groups of seizures we talked about. Now let's talk, that would be the generalized and partial. And then there's the types of anti-seizure drugs, and this is what we're going to focus on here. Sometimes you have to use more than one drug to help maintain the seizure. So you may see an individual on two types of medications. That's not uncommon. The very most important thing we teach our patients is they must take these medications on time. No matter what, they need to take them on time. It's important. They need to maintain a therapeutic level of the drug in their bloodstream. A lot of the seizure medications we can actually check to see if a patient is taking them or if it's in a therapeutic range is by doing lab results. And that's not uncommon. We will check it out, because sometimes the patient says, I've been taking this medication, but their therapeutic range isn't how it's supposed to be. So, of course, if it's not within therapeutic range, then what happens is the patient has a seizure. So we may have to increase their dose, give them something extra to help with that. So a lot of times we have to maintain a therapeutic level of the drug in the bloodstream. Next thing we have to remember is drugs prescribed depends on the type of seizure. Um, you know, if you're having grand mals or you're just having tonic, clonic ones, it just depends. They will prescribe what according to what is needed. There are two types of seizure drugs. Of course, we have our first line medications. That's always going to be the first choice. And then there's the second line medications. That's going to be an alternative. Sometimes you may get first and second ones combined. So that's what we're looking for. But our first choice is our first line medications. That's always the first choice. Before we give any of these seizure medications, we want to make sure we get a complete list of all the medications they're taking, as well as over-the-counter and herbals, and of course, a list of all their allergies. We want to make sure we check vital signs, get a level of consciousness, and to know how the patient normally is before having a seizure, so we know what we're working with. We want to know their gait, because some of these will interfere with stuff, so we need to monitor a gait. And we want to make sure we describe the seizure. Do they get an aura or a certain smell? An aura is like someone will say, oh, I think I'm going to have a seizure. I'm getting like a certain smell or a sensation before it occurs. Different people have different auras before having a seizure. And then that will tell them, oh, a seizure is going to come. I need to maybe sit down. I need to tell someone, or I need to do something because it is going to occur. Safety concerns will always be the biggest things. We want to make sure we put side rails up, bed at the lowest position, and call light within reach. And we want to make sure we pad those side rails because we don't want the patient hitting their head on something hard. Females, we must ask if they're pregnant or planning to become pregnant or breastfeeding because a lot of these can cause issues with the fetus. And afterwards, we're always going to make sure we recheck the level of consciousness. How is this patient acting afterwards? What is their post-ictal state? Are they acting normal or does something change on them? So we need to know their level of consciousness after we give these seizure meds. We also want to make sure we recheck the vital signs. Safety concerns will be a big thing. Drugs can cause dizziness or drowsiness, so we want to make sure the patient is safe. So that's a big thing. We're always watching for any type of seizure activity, and we're going to respond appropriately if one occurs. Teach our patients, please keep your appointment with your doctors and make sure you have your lab work drawn to make sure your levels are in therapeutic range, because if they're not, they may have to adjust your medications appropriately in order for you to feel better and not have a seizure. If you have a missed dose, take it as soon as possible, but never double dose on it. Ask before you take any over-the-counter drugs or herbals. And safety concern will always be an issue, especially because it causes dizziness and drowsiness. Operating heavy machinery, we have to be very cautious with that because we don't want you to get dizzy or fall asleep. We also want to make sure you get up slowly, and very important to avoid alcohol, because alcohol is a central nervous system depression. And if you're getting drowsiness and dizziness, that's just going to increase that effect, and we don't want that. So they should avoid alcohol at all time when they're on these medications. They do recommend wearing a medical alert bracelet. These medications can cause some GI problems, so they tell you take it with food and drink lots of water with it. No grapefruit or grapefruit juice, because it will increase the action of the med and can lead to more side or adverse effects. So no grapefruit or grapefruit juice. And report to the doctor if you're having any symptoms, because these drugs can increase the risk for bleeding. So we need to monitor for that. So we're going to talk about the first line of drugs, and those are going to be on page 407. There are 3 first-line drugs that this book talks about. We have carbamazepine, which is Tegretol, and we do give lots of that. Phenytoin, which is Dilantin, and valproic acid, which is Depakote. All 3 of those I've given for seizure activity. So those are uncommon ones. Side effects for this, you can see those for the first line in generalized partial is on 407. Ataxia, that's loss of coordination or clumsiness. That's why you need to know what their normal gait is. So side effects can be ataxia. Dizziness. Dizziness is one that we are concerned about. Lightheadedness, drowsiness. That's why it's important to avoid alcohol at all costs. It will increase the effects of any anticoagulant drugs. So we need to watch for abnormal bleeding if they're on any anticoagulating drugs. They do cause some GI symptoms, indigestion, nausea, and vomiting. That's when you take any valproic acid or phenytoin, that's when you're going to get a lot of GI issues with them. Phenytoin can cause diplopia, which is double vision. It can cause nystagmus, which is rapid involuntary movement of the eyes. It can cause hypotension, gingival hyperplasia, which is excessive growth of the gum tissue. I always call them the horsey gums. Very important to make sure we teach our patients to visit the dentist when they get those gums and to brush and floss very carefully. They can get hypertrichosis. That's basically growth of hair in areas not normally hairy, and also rashes. Actually had a student who actually created a poem in regards to phenytoin because of all these side effects that occur. So I'm just going to go through because I thought it was kind of neat. It kind of covers all those things. It says, your eyes are too fast, you're seeing double. Your gums grow out and your BP is low and subtle. Your hair grows in unwanted places and stashes. Inspect your skin, you're going to have rashes. So those were some of the side effects that come with phenytoin, which I thought was a cute little poem thing. So I thought I would share that. Another thing we need to also remember is report immediately if difficulty coordinating your movements. Like I said, the skin rashes, the bruising, the petechiae, bloody nose, or unusual bleeding. Those are some things that we need to watch and monitor. So those are the side effects when we're dealing with these drugs. Now, adverse effects. Carbamazepine and phenytoin, you can have neutropenia. So we know that's a decrease in white blood cells. So if anybody's complaining of sore throat, fever, and chills, they need to report that right away. We know that a normal white blood cell level is 5,000 to 10,000. So that's something that we have to watch. So very important with carbazepine or Tegretol to avoid crowds because of your decreased white blood cells. We don't want you to get infection and stay away from those dirty little kids. Also, it can cause aplastic anemia. So you have few red blood cells produced by the bone marrow. So you have high risk of infection and you have a decrease in oxygen being delivered to the tissues and cells because of the anemia. So those are some things that we're concerned about. So that's the first thing, neutropenia and aplastic anemia. Now, carbazepine can cause thrombocytopenia, so that's low platelet count. So that puts you at risk for bleeding. So now it affected all the stuff in the bone marrow. So white blood cells, red blood cells, and platelets. So those are some sort of thing. Now, phenytoin can cause STVJ, so Stevens-Johnson syndrome. And we know this is a bad thing, and something that needs to be reported ASAP if any rashes do occur. We have to make sure because that's indicating an allergy to this medication. Now, valproic acid can cause damage to the liver and inflammation to the pancreas. So it can cause hepatotoxicity as well as pancreatitis can occur. So those are the adverse effects when we're dealing with these medications. Before we give these meds, we want to make sure that we have, if we're giving it IV, make sure we have a very good IV site before we give these. Another thing is we want to make sure with phenytoin, you need to know all the drugs, other drugs that they're taking because it interacts with so many things. So phenytoin, if you're taking any other drugs, you need to know every drug they're taking because it interacts with so many different drugs. So that's why it's important to make sure we have a complete med list of what they were prescribed as well as over-the-counter and herbals because phenytoin interacts with a lot of other drugs. So it's very important to know that. So what do we do after we give these meds? We're rechecking the gait. We're rechecking their mental status, frequent mouth care. We're going to make sure if they, if their stomach is upset, tell them to continue to take it with food. Drink a lot of water because the drugs will dry the mouth and increase urine excretion. So that's very important to drink a lot of water. And look for abnormal bleeding and make sure we report that ASAP. We're going to teach the patient that it's very important to get their lab test to check the med level, also to check the liver damage, for any liver damage, because we know that these medication can cause problems to the liver. So we want to check that. Birth control pills may not be effective when on these meds, so you may need other forms of contraceptives. Carbamazepine or Tegretol, very sensitive to the sunlight, so make sure you wear protective gear. Phenytoin or Dilantin, we already talked about the excessive growth to the gums. Be careful, visit the dentist more frequently and watch with brushing and flossing. Phenytoin or Dilantin, take at least 2 or 3 hours before or after antacids. So 1 hour before, 2 hours after we're hitting with to decrease the absorption. Valproic acid or Depakote, you'll have blood problems that can slow healing and increase risk for infection. So we have to monitor for that. In the pediatric population, we have to be careful with phenytoin because we have to watch for that gum growth. We don't want to do that for the child. Carbamazepine, there we go. We need to make sure we watch with that because it will actually increase behavioral changes in the kid. Adolescents will need higher doses as they grow, and you may not take the med due to skin and gum changes. So if they start having issues, they will stop that medication. But as they grow, they need to increase their doses. Pregnant and breastfeeding population, they do cause birth defects, seizures, but you have to think if the mom's on seizure medication and she's pregnant, she may have to take it because think about it, if she has a seizure during pregnancy, this is going to actually cause a decrease in oxygen to the fetus, and then we can have some issues with mental status. You can have physical changes to infants when mother took large doses of the medications. Like phenytoin, there was risk for cleft palate. Valproic acid had developmental or cognitive defects, low IQs and liver damage, and it does pass in the breast milk. So it's very important for them to talk with the physician, especially if they plan on becoming pregnant, and some things that they can do or not to do. Now, our older population, they will experience more of the side effects, safety concerns with the patients. They can develop chest pain or abnormal heart rhythms. And this is the case, we want them to go to the emergency room ASAP. So they may have to call 911. So those are our first line medications. And I think that is for our generalized and partial, I want to say. Yes, for partial and generalized seizures, okay? Now, the second one we're going to talk about is our first-line drugs for absent seizures. And these are on page 409. When I talk about absent seizures, these are the ones that are staring off into space. They're like in a daydream. And you see this more in children, and usually it will happen about 20 seconds long. So that's what we're talking about. We're talking about first-line drugs for absent seizures. And there are two types, and those are on page 409. We have ethosuximide, and we have, of course, Depakote again, or valproic acid, which is Depakote. So you'll see that in for use for both of them. Side effects for these, you can see also GI problems big time. Indigestion, nausea and vomiting, constipation, loss of appetite, and weight loss. Valproic acid, we already talked about, can prolong bleeding, can cause confusion, drowsiness, dizziness, headache, depression, and nervousness. So it's very important to report any allergic reactions that they can occur, like rashes and fevers and sore throats. If there's any bleeding, like bruising, petechiae, bloody nose, or unusual bleeding, they need to report that ASAP. Now, adverse effects, valproic acid can cause liver damage, which we talked about in the last. It can cause pancreatitis. It can cause bone marrow suppression. So we know that puts them at risk for infection, bleeding, anemia. So it's going to decrease white blood cells, red blood cells, as well as the platelets. So what do we do before we give these meds? We're going to do coagulation studies. We're going to do a liver panel. We're going to check the white blood cells and the red blood cells and the platelets. So we're going to do a CBC. We want to make sure we get a baseline weight. After, we're going to make sure they weigh themselves daily. If it upsets your stomach, take it with food. We're going to teach our patients, take it as prescribed. Don't miss a dose, take as soon as possible, but never ever double dose. And don't stop suddenly because you are going to have a seizure. So it's important to take it faithfully. If you're having issues, then you need to talk to the doctor about that. and report to the doctor if having any type of surgery or dental work. If you vomit on valproic acid, or which is Depakote, and you can't keep the medication down, then you can go to the emergency room or the doctor's office to get an IV dose of the medication. So that's very important. If you're having issues in vomiting, you can get an IV dose of meds to help with that. Pediatric population, valproic acid can cause, if 2 and younger, risk for liver damage and death. And of course, it would increase the dose as they got older. And pregnant and breastfeeding population, again, we talked about already the increased risk for developmental or cognitive defects like low IQ, birth defects, and liver damage. So talk to the OBGYN, and it also passes in the breast milk. And our older population with valproic acid, more sensitive to the side effects, especially the dizziness or sleepiness, and precautionary measures, safety, so they can prevent falls. So that's what we have to watch for. So those are our first line. Now, when we're talking about our second line, these are all the alternative drugs for seizures. And these are going to be on page, page 411, okay? And these are your second line drugs. And there are clonazepam, which is Klonopin, gabapentin or Neurontin. And remember, we talked about gabapentin because it's also used for pain control for neuropathy and fibromyalgia. So you'll see a lot of times people say, oh, gabapentin, that is for seizures. Well, it is not just for seizures. We do use it for pain control. So you'll see it a lot for both of them. So always check and make sure, why is the patient on it? Is it for seizures, or is it being used for like diabetic neuropathy or any type of pain? We have lamotrigine, which is Lamictal. We have our phenobarbital, which is Luminol. We have our pregabalin, which is Lyrica. We have our primidone, which is Mycilins. So those are common ones, and you can see the doses all on page 411. Side effects are also on that page too. And you can also see at the bottom on page 411 and 412 will give you specific ones for each drug, the side effects. But the common side effects will be dizziness, drowsiness, GI upset, clumsiness, and unsteadiness. Usually they're prescribed second-line drugs with other seizure medications, which can increase the side effects. So a lot of times they will give lower doses if they do that. Gabapentin, when given with morphine, can actually increase the blood level of gabapentin. So you may need a lower dose of this med if you're taking morphine. Anticoagulant drugs, like primidone, will decrease the effects of them. So you may need a higher dose of the anticoagulant. So these are some things we have to watch for. Adverse effects. Clonazepam. Clonazepam is a benzodiazepine, which is a central nervous system depressant, which will actually lead to respiratory depression, and that's important. So anytime you have a benzodiazepine, which is clonazepam, it can cause that central nervous system depression, lead to respiratory depression, okay? And there is a reversal to it. There's an antidote, and it is flumazenil, which is Ramazicon. So it is FLUMAZENIL. That's flumazenil or Ramazicon, ROMAZICON. This is the reversal for people who are taking benzodiazepines. The bad part is if you reverse someone who is taking benzodiazepines, maybe they overdose on it, you have a high risk for that patient having seizures because you're removing all that medication out of their system. So there is a reversal for benzodiazepines. That is an antidote, so put it on your papers. So that is an adverse effect, that respiratory depression that can be caused by the benzodiazepine, clonazepam. Now, lamotrigine can cause Stevens-Johnson syndrome, and it can cause toxic epidermal necrolysis. Phenobarbital will actually cause closure of the larynx. It can cause shock, decreased white blood cells, respiratory depression if it's in higher doses. Can cause central nervous system depression, coma, or death. Hives underneath the skin, that angioedema, which is a bad. You can have reaction to the administration of a foreign serum. which is nice to know. So those are some of the adverse effects, but the big one is that clonazepam, respiratory depression, central nervous system depression, benzodiazepine, that is, and the reversals for it, as well as, the phenobarbital can cause like the main things like change in your white blood cells, respiratory depression if in higher doses, angioedema, things like that. So what are we going to do before we give these meds? Antacids and gabapentin, schedule at least 2 hours between these meds. So I think we said 1 hour before, 2 hours after, we're going with that. Ask the older population if they have any liver or kidney disease. And we're going to check our IV site before we give any of these meds. We want a good IV site. Another thing we want to know, and this is very important, clonazepam. Or Klonopin. Ask if they smoke, because if they do, it will decrease the effectiveness of this medication. So they cannot smoke if they're on clonazepam, which is Klonopin. They cannot smoke because it will decrease the effectiveness of the medication. So that's something to do. Afterwards, if they develop any rashes, we're going to hold the med and notify the doctor. Lamotrigine or Lamictal can be slowly increased over 6 to 7 weeks. If skin rash, that is the first sign of CVJ. So we have to watch that, as well as the toxic epidermal necrolysis. So those are some things that we have to monitor for when we're on that. GI problems, then give it with food. Do lab tests as ordered to make sure those labs values are good and everything's okay. Teach the patient to report any allergic reactions. Report if they're having any seizure activity, because they may need their medication adjusted. Phenobarbital and clonazepam are habit forming and should only be given as prescribed and over a certain period of time. So phenobarbital and clonazepam are highly addictive and should only be given over a certain period of time. Phenobarbital and primidone interfere with birth control pills, so you may have to use other forms of contraceptives, and report if pregnant or plan on becoming pregnant or breastfeeding. Avoid alcohol at all costs, because it will cause you to have a seizure. You should not be drinking. It's a CNS depressant and it's going to cause issues. Gabapentin in diabetics can affect the dipstick test for protein in the urine, so that's not uncommon. And as I say, don't smoke if you're on clonazepam. It will decrease the effectiveness of the drug, may need higher doses of the drug if you are a smoker. And don't stop suddenly taking pregabalin. It can cause frequency of seizures to increase. Pediatric population, high risk for rashes, more sensitive to gabapentin because you can have a fever, hyperactivity, they can become hostile or aggressive behavior. Pregnant or breastfeeding population, lamotrigine can cause dizziness. It limits the production of folic acid, which is needed to prevent birth defects. So people who are on lamotrigine should take folic acid supplement. So that's important. So the pregnant population, if they're taking lamotrigine, because it will limit the production of folic acid, they should take a folic acid supplement. Primidone can cause some bleeding issues in the newborn, so probably not a good thing. And it does pass through the breast milk, but they should always talk to their OBGYN. And of course, last but not least, let's talk about the older population. Our older population have more of the side effects due to sensitivity to the drug. Primidone can cause the restlessness and excitement. Lamotrigine and gabapentin are eliminated slowly from the body, so they will always start them on lower doses. And safety will be a big thing. So that's information about seizures. If you have any questions, you know what to do. Okay, have a good one.